As high schoolers, we're all tired. But has it ever occurred to you that there are some people who can't cure their tiredness by just sleeping it off? When I was 9 years old, my parents were discussing with me why my oldest sister was constantly falling asleep and why she was taking medicine. It was because she had narcolepsy. But what is narcolepsy? During this presentation, I will introduce to you what narcolepsy is, where it all began, and how it can be treated. Narcolepsy is a sleep disorder characterized by excessive drowsiness, sleep paralysis, hallucinations, and in some cases, episodes of cataplexy, which is partial or total loss of muscle control, triggered by a strong emotion such as laughter. Narcolepsy with cataplexy is caused by the loss of a chemical in the brain cell called hypocreatine. Hypocreatine acts on the alerting systems in the brain that keep us awake or regulate our sleep cycles. The cluster of brain cells which create hypocreatine is completely destroyed or damaged. Without it, the person has a hard time staying awake or maintaining a sleep schedule. Though there's no known cause to narcolepsy, it is hereditary, and I had then discovered that my great-grandfather had it as well as my father. My mother was sure none of the rest of us had it, but 2 years later, my other sister was diagnosed, and a year later, my third sister. This was really surprising to my family, but it explained why they were constantly falling asleep and sleeping their days away. Narcolepsy is equally affected in both men and women, and roughly affects around 1 in 2,000 people. From a young age, I had shown symptoms of narcolepsy, but because I have ADHD, I already take the medicine used to treat it, so there was no point in me being diagnosed with something I already take. Now that we know what it is, let's talk about where it all began. The first case reports were by Westphal in 1877 and in 1880. The unique association of episodes of muscle weakness were triggered by excitement were present in both of these cases. Hereditary factors were also present, starting with Westphal's patient's mother, as well as another patient's sister. More research has been done at Stanford University with Dr. William C. Dumont and Dr. in the 1970s. Though it is an incurable disorder, there are numerous ways it can be treated. Narcolepsy is diagnosed by physical exams, sleep studies, and medical history. The most effective treatment would be a combination of medication and behavioral changes. Some medicines you could take would be Xyrem, which is highly effective for cataplexy, Ritalin or methylamphetamines, and antidepressants. For those who choose not to medicate, behavioral changes might be the better option. For my sister, going gluten-free has noticeably changed the way that she deals with her narcolepsy. Some methods you could try at home would be to maintain a strict sleep schedule, scheduling naps during the day, and exercising regularly. Presenting this topic has not only allowed me to understand what narcolepsy is. It's not just about being tired. It's an incurable disorder that's not so easy to live with. You constantly feel tired, and you experience hallucinations and sleep paralysis, and it affects around 3 million people worldwide. I've also learned that though it was only widely recognized in the 70s, cases date all the way back to the 19th century. I've also learned that with a combination of medications and behavioral changes, people with narcolepsy can lead normal and productive lives. Presenting this topic has really allowed me to understand something that is widely present in my family, and it's helped me understand that it affects so many people and there are so many ways to treat it.